Hello everyone. Welcome to today's workshop. We are going to talk about implementation of opioid prevention and treatment initiative. Opioid Task Force Oregon and State Opioid Collaboration Project, which is held August 14, 2021. Presenter is Amani Barton, MD, Senior Health Director. The overview: in 2018, Oregon providers wrote 57.3 opioid prescription for every 100 person in 2018, compared to the average U.S. rate of 51.4 prescriptions. This is the lowest rate in the state since 2006, when data became available. In Oregon, drug overdose deaths involving opioid totaled 339, a rate of 0.8 in 2018, and have remained level since 2012. Death involving prescription opioids or heroin remained steady, with respective of 151 and 154 in 2018. Deaths involving synthetic opioids rather than methadone, mainly fentanyl and fentanyl analogs, trend up to 97% in 2018, more than twice the 43 deaths reported in 2016. For more information, you can look at the website listed. And in this figure 1, it shows the number of drug and opioid involved overdose deaths in Oregon by opioid category. Drug categories presented are not mutually exclusive, and deaths may have involved more than one substance. Source is CDC Wonder 2020. Work groups have convened and projects are underway, all aimed at reducing opioid misuse and overdose. These significant steps forward include approval of statewide prescribing guidelines by a work group of statewide providers, chronic use opioid reduction strategies with the CCO statewide performance improvements project, naloxone availability, increase in medication-assisted treatment, coverage of non-opioid therapies for pain and prescribing limitation policies, community intervention in high-burden regions, and ongoing surveillance of controlled substance prescribing and drug overdose outcome. And for more information, you can find that data dashboard is available with state and country statistics for opioid-related health outcome and prescribing metrics. Primary goals is to reduce risk to patient by making pain treatment safer and more effective, emphasizing non-opioid and non-pharmacological treatment, reduce harms to people taking opioids, and support recovery from substance use disorder by making naloxone rescue and medication-assisted treatment, which is otherwise known as MAT, more accessible and affordable. Protect the community by reducing the number of pills in circulation through implementation of safe opioid prescribing, storage, and disposal practices. Optimize outcome by making state and local data available for monitoring, evaluating, and informing policies and targeted interventions. Work groups have convened and projects are underway, all aimed at reducing opioid misuse and overdose. These significant steps forward include approval of statewide prescribing guidelines by a work group of statewide providers, chronic use opioid reduction strategy, the CCO statewide performance improvement, improve access to MAT services for patients throughout the state, educate partners and stakeholders on the value of increased MAT utilization and partnering partnering on innovative ways to serve Oregon opioid-dependent population and increase the number of buprenorphine waived physician in practice in Oregon. Educational objective by the end of this presentation is by the end of this learning session, participants will be able to learn strategies to reduce problematic prescribing, use opioid prescription guidelines for pain management and in emergency departments, use the Oregon Prescription Drug Monitoring Program to access and manage patients' prescription, provide coverage for non-opioid chronic, non-cancer pain treatment therapies, increase the number of providers who are certified to provide medication assisted treatment, MATS, services, in conjunction with local substance use treatment programs. We also evaluate risk of addiction. Estimated that 2.1 million people in the U.S. are addicted to prescription opioid, and this number is rapidly rising. Risk of addiction to opioid is higher if family and personal history of substance abuse, age 16 to 45, history of pre-adolescent sexual abuse, psychological disease. Addiction risk. Long-time opioid therapy is associated with little risk for addiction when given to selected patients with chronic non-cancer pain and no history of substance addiction or abuse. However, recent studies show continued rate of opioid use. A study found that 10% of those who were prescribed opioids within 7 days after low-pain surgical procedures were still using them 1 year later. A study found that 6% of the patients continued their post-operative opioid prescription for more than 150 days after surgery, and about a quarter of patients having total hip or knee arthroplasty were still taking opioid 2 years later. Opioid risk to length and time. 5 items less than 1 minute to administer and score. Assess risk of burden behavior when patients are prescribed opioids for chronic pain. Provide excellent discrimination between high risk and low risk patients. Patients categorized as high risk on the ORT have an increased likelihood of future abusive drug-related behavior. Method to use for this presentation is workshop presentation in the dissemination of scholarly, use of team-based learning in the preclinical, medical school courses and written materials, interactive or hands-on, questionnaire, ask for feedback, CDC and government websites. Addressing opioid epidemic involves many local, state, and national partners. In Oregon, our opioid initiative partners include the following. In Oregon, we have Coordinated Care Organization, which is also known as CCC, Emergency Department, Line for Life, local public health departments, opioid treatment programs in Oregon, Oregon chapter of the American College of Emergency Physicians, Oregon Health Leadership Council, Oregon High Intensity Drug Trafficking Areas Program, Oregon Pain Management Commission, Pain Management Clinical and Public Safety, National CDC, and Substance Abuse and Mental Health Services.